help, I have a headache and I'm breastfeeding, or I have some pain. What can I safely take while I'm breastfeeding my baby? First of all, if you have new onset headache, start by drinking some water. I see many new mothers who are breastfeeding who are not getting adequate nutrition and hydration because of focusing on their little one. If you have a new onset headache, before reaching for the medicine cabinet, start by hydrating with water, soups and broths, or high water fruits and vegetables like melon, pineapple, citrus fruits, cucumber, lettuce, and celery. If that doesn't do the trick or you have pain, there are safe medications to take. Dr. Hale, who wrote the textbook on medication and mother's milk, categorized medications into 5 categories. L1 is considered safest, L2 is safer, L3 is probably safe, L4 is probably hazardous, and L5 is hazardous. If you have pain such as a headache, body aches, pain post-delivery, or a fever, there are safe medications to take. Ibuprofen, Advil, and Motrin are all non-steroidal anti-inflammatory analgesics, or NSAIDs, and considered L1 or your preferred medications. Panadol, acetaminophen, or Tylenol are analgesics that are also considered L1 and safe for pain relief. While Aleve, or Naproxen, is also American Academy of Pediatrics approved for nursing mothers, Hale, in his Medications and Mother's Milk textbook, says it should be used with caution due to its long half-life, meaning it stays for a really long time in the body, and its effect on baby's cardiovascular system, kidneys, and GI tract. So if you need to use Aleve or Naproxen, Hale recommends very short-term, infrequent, or occasional use, and that could be considered safe while breastfeeding, but if at all possible, to consider a different medication. I have a sore, itchy throat and a cough, but I'm breastfeeding. What can I safely take? In general, treat only the symptoms that you're actively having. There are many combination medications out there, but if you're not having all of the symptoms, try to find the medication that is specific to your unique individual symptoms. Short-acting medications that last less than 6 hours are preferred over long-lasting medications because the dosage tends to be smaller that actually gets into your breast milk that could pass to your baby. How you take that medication does matter. Nasal sprays and topical rubs have less likelihood of getting into your breast milk than something taken orally. If you have a dry, itchy nose, a runny nose, nasal congestion, things like saline rinses, neti pots, anything like this that's just saline up the nose, absolutely safe and compatible with breastfeeding. Short-term use of nasal sprays like Afrin, also considered safe, as the risk of that getting into your breast milk or having an effect on your breast milk is relatively low. Throat lozenges and sprays are also generally considered safe, but avoid eating excessive amounts of cough drops with menthol, as some people have reported that menthol and or peppermint can have that risk of decreasing milk supply. Doesn't happen for everybody, but it has been a reported side effect. There are lots of natural remedies for sore, itchy throats, coughs, and all of the symptoms associated with colds, flus, or allergies. Drinking lemon and honey or chamomile tea can be helpful to soothe the sore throat and reduce coughing. Fenugreek tea, interestingly enough, has also been reported to have a similar effect, but make sure that you do not drink fenugreek tea if you have a thyroid disorder or on thyroid medications or tend to go hypoglycemic, as it can have a drug interaction and cause low blood sugars. It may also cause bloating and gas for you and the baby. If you normally drink fenugreek tea for your milk supply and don't see any of these side effects, it could be okay to take this when you have a cough. Other things that you could do include lozenges like zinc gluconate or slippery elm bark lozenges, which can be soothing, but you do need to avoid zinc in large quantities for more than a week because it can interact with the mineral absorption in your body. Salt water or apple cider vinegar gargles in your mouth, where you gargle and then spit, can also bring some relief to some of the symptoms that you're experiencing and would not be anticipated to impact your milk supply or cause any side effects for your babies. Medications like Robitussin and Delsym are considered compatible with breastfeeding, but always check the active ingredients because there are many versions available that have combination medications in them. If you are taking another medication for pain or fever or have any questions about the medications that you're taking, you can ask your preferred IBCLC lactation consultant to look it up in Hale's Medication and Mother's Milk textbook, which has all of the most relevant information about all of the medications we've studied with breastfeeding. You can also look these up yourself on the LactMed database on the internet. All you need to do is type in your medication and breastfeeding, and that LactMed information should pop up on the safety of that medication. If you are in the United States, you can also call Infant Risk, which is a center you can call to ask about medications and breastfeeding. That phone number is 806-352-2519, and they are open from 8 a.m. to 5 p.m. Central Standard Time. Now you know.